Thank you, President Phil. Let me also welcome Monica Cronin as our guest, who is the Director of Development at the College of Nursing. She's been with us before. And Al, thanks for noticing we are having service this afternoon at 5 o'clock, and I'll expect you there. It is my pleasure to welcome Dean Jeanette Andrews from the USC College of Nursing, who will discuss with us nursing education and healthcare issues with us today. I've heard it said before that if you're lucky, one of the first persons to welcome us into the world will be a registered nurse. And again, if we're lucky, when we depart this life, we will be blessed if a nurse is involved in our care. I've also heard another question asked from time to time, and I think these affect us all, and that question is, who do you want taking care of you at 2 o'clock in the morning? I know that one of the reasons that Dean Andrews wanted to be here today is to say thank you to our club for our advocacy and support of the Children and Family Healthcare Center, which is operated by the College of Nursing. And speaking of luck, I probably wouldn't be standing here before you if come next year I will be married to a nurse 55 years. So I've been lucky too. But anyway, Dean Andrews is the 7th Dean of the University College of Nursing. Things at the university, Terry, keep getting better, including the football team. Prior to coming to USC in January 2013, she served as the Associate Dean for Research and Director of the Center for Community Health Partnerships at the Medical University of South Carolina. She, as an alumna from the USC PhD program, Dr. Andrews has achieved success as a National Institutes of Health funded investigator for multiple community targets, cardiovascular risk reduction, and tobacco control. She has authored over 200 publications and abstracts, has served as a national consultant, and contributed to multiple national task groups related to health and nursing. She is a fellow in the American Academy of Nursing, a Robert Wood Johnson Nurse Executive Fellow, and a AACN Wharton Executive Fellow. Clinically, Dr. Andrews is a family nurse practitioner and has 28-year history in the field of nursing, working in multiple areas, including medical, surgical, intensive care, primary care. Among her many awards, she has received the South Carolina Care Hero Award, Falcon Gold Award, the VA Administration National Professional Award, and Nurse of the Year in Georgia in 1998. Please give Dr. Andrews a warm spring welcome.
Thanks, Raleigh, for the generous introduction. Raleigh is just a great friend of mine, a great friend of nursing, and a great friend of the College of Nursing. So I do thank Raleigh and Ruth for all of their support. And absolutely want to thank the Rotary Club for supporting our Children and Family Health Center. What a great, and you'll hear more about that, and you have a brochure on your table about that as well. So Billy, if you'll go to the next slide. A little bit about nurses. One of my favorite things to talk about. Nurses consistently are ranked as the profession with the highest ethics in most trusts since 2005 from the Pew Commission. Only 1 year did another group beat us out, and that was in 9/11, 2001, firefighters. So we are known as a top, trusted, and high ethical profession. Next slide. Also, we're highly employable, especially in these days. The U.S. News and World Report this past year ranked nurse practitioners as the #2 best job in the country, and registered nurses as the #4 best job. So we at the College of Nursing have a really high influx of potential students, a lot of those who are transferring from other professions to come into nursing, and a lot of interest, which is exciting for us. We're having engineers, lawyers, chemical scientists, all are interested, and it really helps our profession really broaden in a lot of ways. Next slide. You probably can't see this too well. This is and I can't see it from back here, so you probably can't see it either. So this is a slide about the South Carolina healthcare workforce. So there are currently about 42,000 nurses in the state of South Carolina. We are the one that was projected the most increase in change. There's about 42,000 nurses compared to about 3,000 to 4,000 physicians and pharmacy somewhere in the middle. And so we are the largest health profession globally, and we are the largest in the state. We are still suffering from a nursing shortage nationally. When the recession hit, it helped us a little bit because some of our older nurses stayed in the market working, and some of the nurses who had gone home to take care of children come back into the market. But as the recession is improving, the shortage is really hitting us again. We're expecting a big shortage by 2020, and we especially have a shortage in nursing faculty. Next slide. So the National Agenda for Nurses was a report prepared by the Institute of Medicine in 2010 and funded by the Robert Wood Johnson Foundation. Next slide. And there are 4 key messages about nursing that this national report from the Institute of Medicine said. First is that nurses should practice to the fullest in their training. We have different levels of nurses practicing in various roles, from registered nurses at the bedside, in clinics and schools and public health settings, as well as nurse practitioners. And often our nurses are not able to practice to the full scope of their license, and that's one of the things that we nationally are trying to improve. Also, nurses should achieve higher levels of education. We know that at the bedside, in the hospital setting, nurses with a baccalaureate degree, the hospitals who have a higher proportion of nurses with a baccalaureate degree have better outcomes with patients as far as lower length of stay. They have fewer complications that are kind of nurse-driven, like pneumonia, bed sores, urinary tract infections. And so the state and nationally, we have a goal to have 80% of nurses at the bedside with a baccalaureate degree. Right now in our state, we're about 55% baccalaureate prepared. We have about 30 programs in the state, and a lot of them are our community colleges that are producing associate degree nurses. And what we're trying to do is promote a seamless way for the associate degree nurses to go back to school, because often in our community areas, this is their only way to entry into college is to go to a community college, but to promote a more seamless way for nurses to get a higher education. And the higher educated workforce in our state in almost any profession, the better outcome that you're going to have. Next slide. We also believe that nurses should be full partners with our physicians and other providers in the in designing of healthcare. With healthcare reform, the best word I can describe what's happening from my perspective is uncertainty. There's a lot of uncertainty in how this is going to be implemented. And we do believe that nurses, as well as our team, has a very important role in restructuring this as we move forward. And the last is about the workforce planning and policy regarding nurses. Next slide. So a little bit about the College of Nursing. It's a great place. It's really a great place. I'm thrilled to be here. I've been here since January of 13. And we have 3 major missions: research, practice, education, and policy partnerships. Next slide. So a little bit about our research. We have nationally funded research going on in our college. 2 main focal areas and 2 main research centers. Our Cancer Survivorship Center, where we're doing a lot of great work with breast cancer survivors, colon cancer survivors. We're doing preventive cancer work like smoking cessation, obesity. And we also, our second center is our Healthcare Process and Redesign Center, where nurses are really great about patient safety and patient advocacy. So the #1 error in hospitals are medication errors, and that's just not a nursing error, that's a team error. But we're doing a lot of work with medication errors and patient safety and emergency triage are some focal areas that we've got funded right now. Next slide. As far as practice, we do have the Children and Family Health Care Center, which there's a brochure on your table. This is a nurse practitioner managed clinic on Two Notch Road. We see about 7,000 patients a year. We provide primary care services to anyone who wishes to come. Primarily, it's an underserved population, primarily women and children, but we take care of people of any primary care issues. We do a lot of management of diabetes, high blood pressure, those sorts of things. It's a really, really great clinic, and your club has sponsored our clinic. Within the clinic, we give books to all kids who come there. We have a lot of different programs for kids and adolescents, pregnant teens, and those sorts of things as well. Next slide. As far as our education component of the college, we were ranked in the top 3% in the country last year for our graduate programs. We're real thrilled with that. We were ranked 16th out of 470 plus programs by U.S. News and World Report. So this was our first time ranking. We hope to get better. And really a great symbol for South Carolina, and certainly the University of South Carolina. Next slide. We have about 224 students enrolled in our graduate programs. We have a PhD program. Yes, nurses do research. And then we have a master's and doctorate nurse practitioner program. We have a family nurse practitioner, acute care nurse practitioner. We're starting back a psych mental health nurse practitioner. There's very few psych mental health providers in our state, and certainly it's a growing problem. I just got data yesterday. Among our college students at the university, 30% are on mental health related medications for depression, anxiety, ADHD. It's a growing problem, and that's a national trend. And mental health is an area that needs to be addressed, and we're trying to step up to the table to provide needed services for mental health. We're also starting back up our nurse executive leadership, which is a doctorate level for usually a chief nursing officer or high-level nurse administrator in the hospital. We have great outcomes with our programs. We have 95 to 100% pass rates on our boards, which is way above state and national average. Next slide. We also have the largest undergraduate program in the state. We have about 1,170 students total, and we have about 675 in our pre-nursing area, and about 480 roughly in the nursing, what we call upper division. And we also have 2 district campuses. It's important to our university to be a flagship for the state, and we have district campuses at Salkehatchie and Lancaster. In those communities, we talked about the 80% BSN prepared nurses at the bedside. Often they have about 10 to 20% of registered nurses have a baccalaureate or higher. So we're trying to help promote a higher educated nursing workforce in our rural communities, which is very important to our mission. Next slide. We've grown, we continue to grow. We do have the largest undergrad program. What we're trying to do now is to grow our grad program. There's a big demand for nurse practitioners in the state, and there's a big demand for nursing faculty, and we have a need to grow our research, which guides our practice. So we're about 1,375 students total. Next slide. And what, I don't know how well you can see this, but we do project to continue to grow, and we're going to grow in that graduate arena. And the last bar is 2017, where we're trying to really grow to meet the demands. We're kind of limited in growing our undergrad program. We do 1,000 hours of training in the hospital setting during the undergraduate curriculum. And there's 4 nursing programs in the Midlands, and there's 4 nursing programs, and there's 6 hospitals, and we're competing. On any given day, you're going to see a nursing student of ours. 480 students in a given day are in one of our hospitals doing clinical. And we just have a shortage of clinical sites for training. So we really can't expand there, but we are able to expand the master's and doctoral level. There's only 2 of us in the state who do doctoral level nursing education, and that's in USC in Charleston and USC here in Columbia. Next slide. Just a bragging point, our nurse boards, we all have to pass boards to get into practice. The top line is USC. The middle line is the state average, the bottom line is the national average. Our students rock. We have the best faculty ever, and our students, we graduate the most students in the state, but we also have the highest pass rate for BSN students in the state. So we're real proud of the quality that we have, as well as the outreach we have among our program. Next slide. So it's kind of some innovations we're doing that may be different for some of you. We have a $1.8 million simulation lab. It's modeled after what they do in pilot training. It's a simulation lab with high fidelity mannequins that our students can learn really high risk situations and safety before they go into the clinical arena. So we're doing a lot of work with our simulation, and it's really incredible. We can make these mannequins, they can talk, they can urinate, they have blood, their heart can stop, their breathing can stop, they can vomit. I mean, they can do just about anything. And so it's not a real scenario, but it feels real when you're in it. And it's really, and they die. And so we audio capture, video capture all of these. It's a learning experience, and sometimes we do it for a competency assessment. We video capture these, and the real learning takes place when we debrief with the students. It's a real cool thing. We invite you to come and see our simulation lab. It really is a model lab. About a third of our students are from out of state, from New Jersey, Ohio, different areas. I asked them why they chose USC, College of Nursing. Well, they know about our quality and our outcomes, but we have a really, they said, comparing the labs, we have a really stellar lab of any that they visited in the country. We are doing online delivery of our graduate programs to make it more flexible for graduate students. Most of our nurses who attend grad school are married, a mortgage, 3 kids, working full-time, so we have to be flexible, and that's the trend today in higher education. Flipping classrooms where they may watch an online presentation at night, and then they come in the classroom, instead of having a boring lecture for 3 hours, they're doing case studies and interactive things. That's a new technique called flipped classrooms. And we're also doing an accelerated completion. We're piloting a new program next year where our BSN students can finish in 3.5 years instead of 4. So we're trying to be flexible, be on your time, and trying to meet the demands. College, as you know, is expensive. And with the lack of continuation for higher education funding, USC receives about 9% of our budget from the state legislature. We used to receive about 40%. So how are we responding? We're having to grow our student numbers to accommodate, and of course tuition is rising. And that's not good to any of us, but that's what's happening. Next step, next slide. So we do welcome partnerships. We have partnerships all across the state with mostly our health systems. Hospitals are providing tuition support for nurses to return back to school. Of course, we do our clinical training in our local hospitals and regional hospitals. We partner with research. We're testing new healthcare delivery models. We also partner with industry, public health, schools, housing, legal, policy. I could go on about the different partnerships that we do. And just listening to your mission for the Rotary Club, our mission of our profession really is very similar. Next slide. So opportunity, we do appreciate the philanthropy that we receive. This past year, we were able to give over $438,000 to 112 students. And that's just in kind from our donors and sponsors, and really just, we're really thrilled to be able to do that. But remember, I have 1,375 students, so we're doing good, but we could do better. We're also looking for opportunities to have endowed professorships, which helps us recruit the best and finest across the country. Our Children and Family Health Center, and we have new space. We're trying to equip that, and I thought I'd mention this here because in Charleston we had a Bank of America donated us an executive desk and equipment that they were discarding, they look great to us. But we have about 15 new office spaces, and we don't have any furniture for it. So if anyone has any executive furniture that you're getting rid of, we'd love to look at it and talk with you about it. Next slide. Also, grant funding and program support. We have grant funding in almost any programmatic area, and that's local, regional, and national. And so we do appreciate your support, but we're always looking for additional resources to really to support our college and our students. Next slide. and that's the end. So I wanted to see if you had any questions or anything that you were interested in you'd like to talk about for, I guess, 3 minutes. Yes.
What is the breakdown of male to female students?
We have 11% male students now. So back when I was in school, it was about 3 to 4%, but now it's 11% in both our undergrad and graduate programs, and that's pretty typical across the country. Yes.
Is that tending to raise the salary?
It could be. Male nurses tend to get in administration pretty easily. A starting registered nurse today starts out about $50,000. I started out about $18,000 in '85.
I started out at $5,000 in 1965.
Yeah. So that's a starting nurse salary. Nurse practitioner salary starts around $80,000 to $100,000. Yeah. Yeah. A nurse anesthesia, that's $120,000, $150,000. Yeah.
Why don't you brag on the type of credentials of the kids that are coming in? Because I think it would shock a lot of people to know that in most colleges right now, the smartest, most academically prepared kids are going into college and nursing.
They are. We have a high percentage of honor students. USC has the #1 honors college in the country, and we have a high percentage of honor students. They have perfect SATs. They're incredible. The low GPA admission for our program last year was a 3.5. Out of 240 students we admitted, the lowest GPA was a 3.5. That's their college GPA.
What's the difference between a nurse practitioner and an LPN?
Difference between an LPN RN and a nurse practitioner. An LPN is a very technical degree. It's usually a year training in a technical school. A registered nurse can come in as an associate degree or baccalaureate degree. A baccalaureate's a 4-year degree. They have more training, of course, in the background of college training in arts and sciences. But we also do more community health and critical thinking analysis and leadership in the BSN program. A nurse practitioner has at least a master's and usually a doctor of nursing, and they can do whatever track they're on: primary care, acute care. Nurse practitioners work in emergency rooms and healthcare offices, and many of you have probably seen nurse practitioners. The Minute Clinic is a model that a lot of people know nurse practitioners, but usually your providers have nurse practitioners in your own offices that you go to.
One more question.
One more.
What's the cost of nursing school for a 4-year degree?
So I should know that off the top of my head. So the tuition is at USC now is about $5,000 a semester. And so, you know, for the 2 years of nursing, you've got your tuition and fees run to about total. You're running about $12,000 a year tuition fees. Yeah. We are much lower though than our counterparts at USC and Clemson. So, and it's expensive to train nurses. We have to have a 1-to-8 ratio in clinical settings with faculty. So I have 75 part-time faculty who do a lot of the clinical training and 45 full-time faculty. So it's pretty expensive for us to train. Our sim lab and those sorts of things are very costly. Yeah. Good questions.